we're pretty much here. So, all right. Thank you everyone for joining us and playing along on our little intro there. If you do have a question during our presentation, feel free to put it into the chat. We will monitor that. If we don't get to it right away, we will make sure to circle back, or just know that it may be something that is coming up in the presentation that we'll get to if you jump the gun. And I get a little excited to ask the question first. So welcome. We are the Lehigh University's College of Health, as you can see in the little candid pictures there. That is your academic support team. I am Monica Sampson, one of the academic advisors in the college. I'm also joined by Ben Moyer. He's our senior academic advisor. He is probably the one that's going to be monitoring the chat while we speak here. Jen Top was also chatting with you in the beginning. She is our Assistant Director of Student Experiences. She works as part of the academic support team. She does a lot with our experiential learning and our study abroad. We work together with Professor Michael Guzmano, who is our Associate Dean of Academic Programs. And then, of course, there is Beth Dolan, the Dean of the College of Health, which she does love to work closely with the students as well. So again, at any point, if you have a question and don't want to forget it, feel free to put it in the chat. If we don't answer it immediately, we will circle back, or it'll be something that comes up in a little, a little bit later in our presentation. So first and foremost, Jen, if you want to hop to the next slide, are you controlling it? There we go. All right, so why the College of Health and what is the College of Health? First and foremost, the College of Health is not a medical school or a school of public health. But unlike a school of public health, that allows us to be a little more flexible with our curriculum. And similar to, a school of public health, or just to broaden what we mean, is our mission is to improve health outcomes for populations, communities, individuals through the research and education done here at Lehigh. We work together to improve human health, primarily by impacting the determinants of health that exist outside of the healthcare system. So we all know and are most familiar with those clinical aspects of health, but what we strive to do is work alongside them to help, your whole health, your whole education, figure out what goes into your health, from not just the germs you may get and you go to see the doctor for, but what goes into determining your whole health, which is known as the determinants of health. And as you can see by our little map here at the life expectancies, that graph is going the wrong way, which is what the College of Health is trying to help to improve. We want to get that little line plot going back up instead of down. And then you can see the kind of life expectancies and the proportion of the population that's over 60. We all hope to get to that retirement age, and unfortunately there's a lot of areas of the world that can't quite do that. So we're here to hopefully help through our research and education. And it's a good time to be interested in a career in health. I'm not going to read them to you, but you can kind of see the numbers here. Overall employment opportunities are growing. There are approximately 2 million new jobs created in the health spectrum, and that is outside of, your typical clinical doctors and nurses and everything as well, which again, we can help you get those positions and get ready for med school if you need to, but this is encompassing all aspects of jobs in health. And then, again, everybody thinks health, they think MD, PT, nurse, doctor, clinical, but these are the other areas and industries our graduates may have an impact in. You can work for the government, the CDC, the Department of Health. You can go the nonprofit route and you can work for things like Beata or the World Bank, or somewhere like the Bill and Melinda Gates Foundation or the WHO that a lot of people have become familiar with. Or you can go private sector and you can see there are a lot of your like pharmaceutical companies, insurance companies, different tech startup companies, more and more items added to that list. Seems like every day. And we do have, we have a lot of those listed there because we do have some of our graduates working at, the CDC, Johnson and Johnson, Genentech is a private company where we have some of our graduates placed. And again, what does making an impact look for you? Again, a lot of you are probably here because you want to know what exactly it means to have a degree in population health or community and global health. And we're really here to help you find your interest or, find your goal based on your interest, find your career based on your interest and how we can take you to that career in the health industry. So here's an example of, some of our majors. They're listed down there at the bottom. We have this slide kind of divided in half to show if you are a little bit more into your kind of individual and society, think your social sciences, your humanities, you might go a route of community and global health, health, medicine, and society. Or you may be somebody who is a little bit more into STEM, and we have biostats. Biostats and health data science are one of our newest majors. We do have the integrated business and health intercollegiate program now, or you're somebody that goes in population health, or we will talk a little bit later about the 4+1 programs and what that means, how you can get out of Lehigh in 5 years with both an undergrad degree and either an MPH or an MS degree. So basically we have degrees that draw on the social sciences and the humanities, which is an effort to understand and work with and improve the health of communities. This work can take place here in the US or anywhere around the world. We have those degrees that draw more heavily on the health data science and allow students to apply the big data to a range of population health problems. All of our degrees, whether you lean a little more on that individual and society side or on the STEM side, all of our degrees provide students with a core set of courses to help them understand the social determinants of health. And you do get a rigorous training of research methods, quantitative, qualitative, all the different research methods. So again, it's up to you. What are your interests? The BS degree, which is your biostats, your integrated health and business, your population health degrees, put a greater emphasis on your quantitative analysis. So think, more numbers heavy, more statistics, more epidemiology. And then your BA degrees, which would be your community and global health or your health medicine society, put a little more focus on the qualitative analysis. So think patient and person interviews when it comes to your data collection. But all of our students will be trained on how to use evidence to advance community and population health. That is the goal. We want to improve health outcomes. So furthermore, in the college, it's the research, teaching, and service is committed to reducing health inequities. And there's kind of a simpler list of our majors, and then it also includes our minors. So maybe you want to do community and global health, but you hold on to an interest in epidemiology. So you can then minor in that as well. We keep adding, we added the biostats major this year. We are adding the integrated business and health degree, which is major-ish. It's a intercollegiate program, so it's slightly different. I don't want to get too in depth with that at the moment. If you have more questions about that, we can come back to it. But that will start next fall. And then we added the epidemiology minor this year, the biostatistics one last year, and then we have some more on deck that they are working on as well. So long story short, the College of Health is growing pretty rapidly too. And if you don't know what major you want to be, that's okay. we actually encourage you to come in undeclared and take those baby steps and try before you buy. Most students enter Lehigh as undeclared. And then once you take a few of our intro classes your first year, that's when we'll have you pick. The only one that's the exception to that is if you are interested in the integrated business and health degree, you do need to apply and start in that one. It's what we call cohort based. So you have to start in it. It doesn't at the moment give you any option to transfer in later. So if that is a program you're interested in, you have to apply directly to the integrated business or health degree, which we like to call IBH. You'll learn quickly that we like our abbreviations and our acronyms in the College of Health, COH, the College of Health. So the IBH program, it is a core required classes from the College of Business with a series of classes in like health economics, health policy, and then you also get the social determinants of health, which like I said is kind of the backbone of the college. And then you get, some courses in research methods as well. And then you get to the program participates in an integrated seminar, which helps you understand the connections between the College of Health courses and your business courses. So you kind of have integrated seminars to tie all the business and health courses together towards the end, which is another reason why it's not really able to transfer into it if you don't have the core foundational courses. It's really hard to do those integrated seminars when you become an upperclassman. So students that go into this program may wish to go on to graduate degrees in like business and regulatory affairs, public policy, but it's designed for people who aspire to fill leadership roles in the health sector. That's what we like to say. So again, you'll apply directly to that major if that's the one you are interested in. We do also have some students who will do a population health degree with a minor in business. You could do things like that as well. There's lots of options for you in that one.
Great. Before we go on to our accelerated programs that we have, I think it would be good to introduce the current students who are joining us. So I mentioned MJ and Rowan. Can you two introduce yourselves, tell what your major is, what your minor is, or if you don't know yet, if you're not declared, say what you think you're interested in and maybe talk a little bit about that. MJ, you want to go first?
Yeah. Hi, everyone. My name is MJ Levu. I'm an international student from Vietnam. My major is population health, and I have a minor in architecture. So it's a very fun mix. So before I came to Lehigh, I was really interested in research. And as soon as I got into Lehigh, I started exploring research opportunities inside campus, and I was very surprised. I think almost all the professors that I have asked do research at Lehigh, and they're very open to having undergraduate students do research with them. Um, yeah, so that was very fun for me.
Can you talk a little bit about what you think maybe you want to do with these two disciplines that are so different?
Yes, so I am studying population health and architecture. They seem very unrelated, but I am trying to get into urban planning, like building cities, sustainable and healthy cities. That's what I'm interested in.
Awesome, thanks. And that's actually an area of interest for a few of our faculty. And think about those social determinants, how where you live is so important to how your health is, not just your genes. Yeah, that's awesome. Rowan, how about you?
Hi, I'm Rowan. I'm also from Vietnam and I'm still undeclared since I'm first year, but I'm planning to major in community and global health.
Can you talk a little bit about what makes you interested in that major?
When I came in, I didn't know what to major either, but I took some introductory classes for both population health and community and global health, and I feel more interested in like global health, so I'm choosing that major.
Awesome. Thank you. Great. All right. So now, you're here learning about the undergraduate programs. And I always say to let this next part just kind of wash over you, because it's hard to imagine graduate school when you're just thinking about going to college. But we have an accelerated program, and a lot of parents' ears perk up when I start to talk about this. The accelerated program, as Monica mentioned earlier, allows you to get not only an undergraduate degree, but a master's degree in just 5 years. And so we have a MS in population health management, which is a great step and kind of the next step to that IBH program that Monica talked about. And it's, if you're interested in population health, it goes a little further in developing novel avenues for disease prevention, health promotion, and intervention. And it's a really great master's degree for students who want to be leaders in health systems or health management in any kind of area. Starting in the fall, that program is going to be offered online and asynchronously, which is exciting and super flexible. Our other master's degree is an MPH, which is a traditional Master of Public Health. And that's a real practical degree, meaning it is one that you are, wanting to work in communities. You want to work in local, state, national, global public health practice and policy making settings. So you're in these areas and you're doing the work, you're doing these interventions. We are right now working towards accreditation for this program, and we're super excited. And it's definitely the popular one of the two master's programs. What the 4+1 looks like is, if you qualify for this, and I'll talk a little bit about what that means, is that you'll take a graduate course in the fall and spring of your junior year, and again in the fall and spring of your senior year, completing 12 credits. After that, you go for one more year, a solid year of being a graduate student, and you'll get a master's degree. Really, really great because it saves a lot of time. Two of these programs are about 2 years. The MS is a little bit shorter, but definitely more than a year for both of those programs. So you save time. And because you're able to take these grad classes as a part of your undergrad experience, that cost is folded into your undergrad tuition. And that's where the parents' ears perk up. So it's not only saving time, it's saving money. The way that graduate credits work is you pay per credit, not when you're doing the 4+1. When you're doing those 12 credits, all of that is just part of your undergrad tuition. So what do I mean by qualifying for this program? Well, if you apply to Lehigh, you can indicate on your application that you're interested in this program, and that's the first step. Then we kind of take a look and see how you're doing. And during your sophomore year, we'll kind of see how you're doing, because the emphasis needs to be on your undergraduate degree, right? That's your priority. And so we want to make sure that you're successful with that. If you have a 3.5 or better, towards the end of your sophomore year, you can just say, I'm definitely going to do it. I want to do the 4+1, and you're in. And we help you to do all the things that you need to do to get into those grad classes. If you don't have a 3.5 because you took a hard class, maybe you're pre-health and you took organic chemistry, as long as you have a 3.0 or better, we just kind of take a look at your transcript and see how you did and why maybe you have lower than 3.5. We understand. Again, we want to make sure that you're successful in your undergrad degree. So that is the priority. A great thing about this program is that you can give it a try. And if you decide before completing the 12 credits that, this is too much, grad school is hard. You have to make sure that you're balancing your needs for your undergrad degree while taking these credits that don't count towards your undergrad degree. And if you decide you don't want to do it, that's okay. You don't have to continue. You're not bound by in any way to continue with the program. Or you might decide, okay, I've done these 12 credits and I got a job after graduation already, and I don't want to do any more schooling for now. That's okay too. You would get a graduate certificate that shows that you completed those 12 credits. So no loss. And you can always come back later as a Lehigh alum and continue the program. And you would get a 30% scholarship as a Lehigh alum either way. So there's really no reason to not try it if you're able to. So again, let that wash over you. It's something that we'll talk to you about as you go along if you end up coming to us in the college. So for those of you who are interested in a clinical career, and some of you did indicate that with psychiatry or neuroscience or something like that, there is no pre-med at Lehigh. So you can, we call it pre-health because it encompasses all the different clinical areas that you might want to work on. And because there's no pre-med major, you can really have literally any major at Lehigh and still go on to those careers. The college would be a great path towards that goal. Along with your major requirements, if whatever major you decide, you'll also take all the prerequisites that you would need to go on to whatever post undergrad schooling you need to do to have a clinical career. And we provide course sequencing that shows you how to complete all those requirements and your undergraduate degree in 4 years. And that we'll talk about advising as we go. If you're not interested in a clinical path, Monica showed you some areas across all of these different sectors that you can work in. Well, here are some jobs that are options as well. And maybe some of these jobs you've never heard of. There's a job in health that I hear about every day that I didn't know about. There's something called a health actuary. That's not listed on here, I don't think. And that's somebody who looks at statistics to see what are the chances of your health getting better, getting worse. They often work for insurance companies. There are more jobs that are listed here in health, and this just goes to show how broad they are. Health is broad. It affects so many areas of our society. And again, there's going to be jobs that aren't even listed here, but this just gives you an idea of where you might go. And I think we need to have on there, MJ, something about infrastructure and city planning, because I don't think we have that on there. And that's a really good one. So here's an example of a real life College of Health student who graduated and how her path looked. And she came in thinking that she was going to maybe be pre-health. She got involved in the Lehigh University EMT. Students do that. You can be trained to be on the EMT corps. She was taking major and minor coursework, because she wasn't sure exactly what she wanted to do. She actually came into Lehigh in a really unconventional way. That's a program called Lehigh Launch that you might want to look into. We have one program in the American West, and that's what Emily did. She was out hiking, camping, doing all of these things with a faculty member while she was taking a course, taking her coursework, and learning about the American West and indigenous populations there. There's another one that's Lehigh in Chile. That you could do as your first semester at Lehigh. So really unconventional way to join Lehigh. And I invite you to find out more about that at an info session. You can talk to admissions about that. So Emily started at Lehigh, not at Lehigh, and then continued on her second semester and tried out a bunch of different things. She ended up being a Lehigh Valley Social Impact Fellow, and that's a program. Impact fellowships are ones we'll talk about in a bit. This one was focused on permaculture and gardening. And this kind of opened up an idea in her mind about being interested in the environment. So she ended up having a minor in environmental science and majoring in population health. She kept a minor in biology because she'd already done some of the pre-health biology. And so she ended up minoring in that. She continued her fellowship into the summer with the Delaware Nation, which is a tribe in the Lehigh Valley. Then in the fall, she went to a conference and presented on the work that she did with that fellowship. Then she studied abroad and got a research internship in a hospital in Spain. Finally, she finished everything up in her majors and her minors in the fall of her senior year while being a research assistant with a faculty member. And she came to a panel that was about the CDC and working in the CDC, and found out about this really cool, highly selective public health associate program. This program I was super excited that she applied to, and just was crossing my fingers, and she found out just a few days before graduation that she had been selected. And this is a really cool program that trains early career professionals who have a recent college degree and are interested in public health and service. It puts you in whole different areas, a bunch of different areas at the CDC over the course of 2 years, teaching you about what the CDC does. And it's a paid job. You're employed by the CDC, but you're also learning. And this is just an example of a student who came in thinking she had one path, and through all the things she tried out, it went to something really cool. And this is just one of the many examples. So we've talked about your interests, what they might be, and then we'll talk about Lehigh. First, again, our college sets us apart from schools of public health because there's so much diversity in what you'll do, and so many awesome experiences with a truly interdisciplinary faculty. You'll get chances to do research with faculty. You'll network with people in all different fields. You'll be engaged with alumni while you're here. You'll also get tons of support as you make your way through your academics with expert major and career guidance. And you'll have an amazing time with all of the Lehigh experiences, because Lehigh is pretty special too. There's so many traditions and opportunities to engage in curricular and extracurricular cool things that shape who you might become. And we have passionate alumni, like I said, who really want to help students and help guide them and give them advice in what they want to do after graduation. We're currently working on a mentor program within the College of Health too, and hope to have that up and running by the time you would get here if you come to visit us or come to stay with us. Not visit, we want you to come and stay. So experiences. Before I go into what my spiel is, I'd love to hear, MJ has had a real diverse bunch of experiences in her relatively short time at Lehigh. MJ, can you talk about what you've done so far?
Hi. So I basically traveled the world with Lehigh. So last winter, I went to the Dominican Republic over winter break. It's a class that we took. It's called Eco-Social Perspectives of Health. So we had to go to school, and we have to go to school in the morning, and in the afternoon we would go to different hospitals and clinics in DR to like see what a day in the life of doctors there would be like. So that was super cool. And then this summer actually, I went to Sierra Leone, which is a very small, beautiful country in West Africa. I went there to make documentaries about maternal health of young mothers in Sierra Leone. Um, and
You did a really cool internship in between those things too. Do you remember your internship after your first year at Lehigh?
yes, so after my
She's done so much.
Okay, so after my first year at Lehigh, I went back to Vietnam. I got an internship with the Ministry of Health and the World Bank Vietnam. We worked on this project called implementing and reinvesting on grassroots health projects um, in provinces in Vietnam. So basically, we went to 14 different provinces of Vietnam, and we implemented this balanced scorecard rating where we evaluated the health systems in these provinces, and we came back to the Ministry of Health to do data analysis and propose policies about it. Yeah, so that actually helped me a lot with my classes at Lehigh, because after that internship, I came back to Lehigh and I became this like super loud, like I participated so much in class. I just got so much to tell. And I can tell that other students hated me because I talked so much. But it was fun. It made me so much more confident. And I think that is why I got to study abroad in Dominican Republic. And I also joined my project in Sierra Leone.
Thank you. Yeah, so the Global Social Impact Fellowship is the program that MJ did with going to Sierra Leone, and that's one of those impact fellowships. I mentioned the Lehigh Valley one. That's a university program. That's really cool. It brings together students from different majors, different levels, with faculty who are doing research projects that you work on during the academic year, and then you go and implement them wherever they are supposed to be. In MJ's case, in Sierra Leone. In Emily's case from the slide earlier, it was right in the Lehigh Valley. So these are just two examples. In the classroom, 25% of your major coursework major credits rather, are experiential. And what that means is that you're working with real data from hospital systems, or you're going into communities to do community-based participatory research. Everything is leading to something. It's not all theoretical. Or, maybe you'll study abroad. MJ did the Lehigh in the Dominican Republic. There are so many programs, 300 plus. Many of them are health related. And you can have them be focused on health, or you don't have to have them be focused on health. But you can do some of your major coursework abroad, and in addition to electives. And that's really something that sets the College of Health apart. There are research opportunities with faculty, not just these special programs like the social impact fellowships, but faculty build into their grants often students participating. So you could do research with faculty as an independent study, or you can do it just because you want to do it, just for fun. You can sometimes even be paid because they built it into the grant. It's as easy as asking faculty if you can join them. It really, truly is. We've had students that have done it as early as the first semester of their freshman year. Then we have domestic and international internships, and we have a new co-op starting in the spring with the Children's Hospital of Philadelphia. These internships are sometimes they're found by students themselves. MJ found her internship. I had nothing to do with that one, but part of my job is helping to develop opportunities for students here in the Lehigh Valley or around the U.S. We're always looking for opportunities for students based on their interests. So the more students share with me what they want to do, the more opportunities we find. Then we have the United Nations Youth Representative Program. And Lehigh is an NGO, a non-government organization, part of the UN, and that's really special. And what this program means is that students have the opportunity to represent other NGOs at the United Nations who maybe don't have the capacity or the money to have representatives there. And so those students get to go to high-level briefings and other UN events representing those organizations. I'm a little partial to some of these international idea ones because I used to work in international affairs, but there's something for everybody, truly. Rowan, is there something that you're thinking that you'd like to do experiential wise, research with faculty or studying abroad or something like that?
Yeah, I'm interested in a lot of things. Like I want to study abroad too, and I also want to do research. I think a lot of the research that professors do at Lehigh are really interesting, and I would love to join.
Awesome. Great. It really is as easy as just asking. They love to talk about their research, and all you have to do is ask.
Jen
So,
gave me,
yeah,
oh,
go ahead. Go ahead. Yeah.
yeah, no, when I came to Lehigh, Jen gave me this advice. When you talk to a professor, if you don't know what to talk about, just ask them about their research because they love talking about their research so much. They're just so passionate about it. So just ask them.
And I don't think that is even Lehigh specific. I think faculty would love at any university to be asked about that. That's a great tip. So here are some of the examples of research projects that are ongoing, that students have participated in. And Lehigh is really good about this. Undergraduates don't often get a chance to do research with faculty because if you're a research university, you're going to most likely be using graduate students. And Lehigh really, really shines in some of those programs I talked about, but then the more informal opportunities with faculty. And you can see that, I love to use Professor McAndrew's example of this research that you're doing is really impactful. They are doing outbreak forecasting and statistical modeling for the CDC on the flu. And so that's work that he does. It's ongoing work that in partnership with the CDC that students get to be a part of. And so that's just amazing to me. So with all these choices, there's a lot to navigate, right? There's a lot. Now you want to do everything. Sometimes we have to have students understand that they've got 4 years to do that. And so you will get help in navigating all these opportunities and the choices and the requirements. And you'll get that from professional advisors. Monica and Ben are the ones here who will be your person. You'll also get help from faculty mentors who will help you guide you on maybe career, or if you want to go to graduate school and how do I do that? What's the best upper level classes for the things that I want to do? Or who should I be networking with? Faculty will help you with that. I'm here to help you to get those experiential learning opportunities and maybe talk about how you can talk about those experiences you've had in a professional way and put it together with your resume. I love to talk about things like that. If you're a pre-health student, you'll have a pre-health advisor who makes sure that you're meeting all those markers for those prereqs to go to PA school or med school or nursing school. We have career workshops. We work closely with the Center for Career and Professional Development to have workshops like the panel that we had with the CDC to help you to know what jobs are like from the people who are doing them. What am I missing? I don't think I'm missing anything. You get lots of guidance in navigating all of these things. And that's really important because there's so many opportunities and sometimes it can really be overwhelming. So finally, and I swear then we're going to leave it up to you to ask questions. I see some in the chat. Maybe we'll be able to answer those. Finally, you'll all have the feeling if you come to Lehigh of knowing you're at one of the best colleges in the nation. That's pretty cool. We're really proud about that. And you'll have opportunities inside and outside the classroom to develop skills, develop connections through clubs, through networking with alumni, as I said, fraternities, sororities, if that's your bag. And of course, you'll find a job. We're really excited about that statistic too. So whether you want to go into graduate school, get a job right after your undergrad, or do some kind of volunteering. Some students do that. They'll do volunteering before they go to med school. 95.4% of our students are where they want to be within 6 months after graduation. And that's something you should be asking all of the colleges that you're going to info sessions for is, what are the outcomes? You need to ask those questions. And we're really proud of the Lehigh experience.